I started the practice 16 years ago based on a frustration as a practicing physical therapist working for a home health agency under Medicare Part A. Home health agencies, it's unfortunate, the regulation which they operate under sometimes is quite restrictive. As a physical therapist working under Medicare Part A, I'm unfortunately not able to dose my patients how the medical evidence suggests, meaning not dose them at a very specific frequency, duration, and intensity. Exercise, which even the most well-trained healthcare professionals, physicians, don't quite yet understand. Exercise is no different than a medication. It needs to be dosed at a very specific frequency, duration, and intensity. Just like if you go to see your physician and he gives you a bottle of medicine and it says you must take 3 times a day for the next 2, 4, 6 weeks or until the medication is finished. That's there for a very specific purpose, and exercise is no different. Very few people understand that. We understand that in geriatrics, and we understand that in aging. We also understand that our patients are medically complex and have multiple chronic conditions which need to be taken into consideration along with their pharmacy when we are dosing our interventions and actually treating them to get them stronger and better and more functional. So unfortunately, under the regulations back in 1998 under Medicare Part A, I wasn't able to provide that level of critical thinking or that high level of thought process and delivery of services to my patients. The allowance was very short in duration, and I'd have to discharge my patients when they needed far more services, and the medical necessity was still there indeed. I became frustrated. I sat and stuck my head in Medicare regulation and policy, and I found where physical therapists in private practice could not only treat their patients in an outpatient clinic, as we all know, but now we could treat our patients and see them under Medicare Part B in their homes or residences. So really that was the light bulb moment for FOX Rehabilitation and the founding moment of FOX, which was pretty exciting. I look at it, if it's my legacy to fight ageism in the world and teach and train and educate other healthcare practitioners and those folks that are indeed aging, maybe folks my age, that they can understand today where they should be when they're 96 years old, that they shouldn't be in frailty and failure, but in fun and function. That's the embedded clinical philosophy of our practice, what every clinician and every person that walks through these doors should understand and leave with that message. It's something that we don't receive, and we fight hard to educate, teach, and train on.